My name is Michaela, and this is what bone cancer looks like. I used to work as a nanny, and I was taking care of a 2-year-old boy, and I had him on my shoulders a lot, and I thought I must have hurt myself doing that because I had really acute neck pain for several months, to the point where I couldn't turn my neck at all, and I literally had to roll out of bed. I saw a shadow in my spine, and it was cancer.
This was the same thing that Terry Fox would have had, the same type of tumor. And the treatment plan, especially in Michaela's case, is very, very demanding on the patient.
I've never experienced anything in my life quite like chemotherapy. It just rattles your entire body. I had a 22-hour surgery to remove 3 vertebrae in my neck and put a piece of my pelvis there instead. That was a really hard thing to recover from.
And the real challenging thing with any sarcomas is when you take it out, you can't enter the tumor. Because if you enter the tumor and spill cells, then it will come back again.
The surgery itself was a very long and intense and complex process, partly because I was a cancer patient, so I had issues with my immune system from treatment, and partly because of the proximity to my spinal cord.
When we take the tumor out, there's nothing supporting her head on her body anymore. So we have to reconstruct her spine to hold her head back on.
BGH is the only place in BC where this kind of complex surgery can happen. So I was very fortunate to be able to receive care there.
We've got to have these facilities in order to take care of these patients properly.
We are a level 1 trauma center. That means we receive the most injured patients in the province. The challenge we have now is that our operating rooms aren't universal. We use multiple techniques to save those patients' lives, all requiring high technology, multiple personnel. Minute by minute, second by second, time is precious. And the expertise that we need to care for patients, the equipment and technology and assistance we need to care for patients, if it's optimized, it has a synergistic effect on patient care.
The quality of treatment that I received really enabled me to get to the place where I am now, whether it was the skill of my surgeons or the care of my nurses and my physiotherapists, my own hard work.
She kept a positive attitude through the whole thing. I think when you look at her, you wouldn't even think she'd had an operation.
I mean, it was immensely hard and painful and lonely, but the reward that you get from seeing how strong you are and what you can handle, it changed everything for me.
Seeing how it affects their ongoing lives is the very most rewarding aspect of our work.
The thing about being sick or getting injured is you never know when it's going to happen or who it's going to affect, and one day every one of us is going to be injured or sick in some capacity.
Small incremental contributions can be leveraged to make significant and massive differences in outcomes.
Realizing that their donations actually does make a real difference, and I think it's really important for us to demonstrate that.
I had no sense of my own mortality. But when it's right there, it really changes something about your psychology. It just becomes about survival. For my grad project at Emily Carr, I had access to my cancer cells, and I printed them out on a huge red canvas. It's called Primary Malignancy in Red. I see pattern, I see form, I see color. I see an interpretation of an experience. My name is Michaela, and this is my new beginning.